So tonight we're going to be talking about osteopenia, osteoporosis, and those sorts of issues, bone health. I'm going to do a kind of a quick overview about some of the questions you might consider addressing or the topics. And um, before we do that, though, we'll give people another minute or two to kind of log on. Are there any questions from anybody? Anything that's burning on your mind that you'd like to have addressed at some point tonight?
I'm on Fosamax, and I haven't been to the dentist for about a little over a year. I have a new dentist. He commented after taking x-rays that my lower jaw was pretty much solid calcium.
So you had a lot of extra bone laid down in your lower jaw?
Yeah. And the Kaiser really doesn't monitor that, I guess. Yeah.
Yeah, so that's great that you have extra bone. There have been some side effects with bone breakdown. And the reason why is if you're giving drugs that either stimulate bone growth or remove excess bone cells, if you don't do it in the correct proportion, you can wind up with a structure that's not very stable. That's generally why it's recommended not to continue on with those medicines for over a 4-year period, that you want to kind of take a break from them for a while. But, it's different for different people, and we'll kind of talk about those medicines at some point tonight. But it sounds like you're having some pretty good success at this moment.
Yeah, I'm due in a few months to have another scan to check on it. I had osteoporosis. I think it's pretty. My left hip was the only place that still, it's kind of borderline between osteopenia and osteoporosis.
Did you actually have a fracture that they diagnosed you with osteoporosis, or was this just off a DEXA scan?
I have Addison's disease, and in my endocrinologist was the one who referred me for the hip, and I don't know if that impacts your bone. I'm on hydrocortisone and food.
But you've not had any fracture.
No.
Well, if you've been on hydrocortisone or prednisone, any kind of steroid, as a result of any condition, whether it's Addison's or whatever, that increases your risk for osteoporosis, being on steroids.
Yeah, I think that's why they had me checked. Maybe 15, 20.
Makes sense.
So I've had Addison's for the last 50 years.
All right. Any other thoughts from anybody else? Looks like we have over 20, the quorum number we've used in the past. Just kind of playing with that. It's not a have to, but it's nice to have a number of people. Any other thoughts from anyone? If not, all right. I'm going to go ahead and share my screen. Scott, do you have anything that you want to share before we, I get to run off at the mouth here for a little bit?
No, unless there's anyone that's new that wants to speak up and tell us how they heard about the classes. If there are any new people, I think I recognize all the names.
Okay. It's an older group, and wow, we're up to 25 now. It just keeps bumping up bit by bit. Okay, I'm going to go ahead and share the screen. Hopefully you can all see this.
Yep.
Okay, good. And then I'm going to, it's being recorded, so I'm going to throw up the first boring document. I'm going to kind of just scan through the issues before we discuss them. And then we'll have time to discuss each of these later on, should you wish to discuss them. So if you're concerned about osteopenia and osteoporosis, you're concerned that you might be having broken bones, and breaking your bones, particularly at an older age, puts you at higher risk. So if you don't want to break a bone, the most important thing you can do is don't fall. And so in order to keep from falling, it's important for you to maintain your muscle strength and balance, not be dizzy,
Oh,
so
okay.
keeping hydrated.
Okay.
And I guess I'm going to have to mute everyone for a moment. Let me see if I can do that quickly. I see the participants here. Okay, I'm going to mute everybody here. There we go. And good. All right. Well, that allowed us to get up to 27 anyway. So the number keeps going up. Let me cancel this out and get back to where I was. Easier said than done sometimes. Why can't I get back to my screen? Oops, that's not what I wanted. There it is. Okay. All right, so don't fall. How do you do it?
Now share your screen again, Charlie.
Oh, okay. Thanks, Scott. Will I ever learn? It's what happens is when I move too fast, the share screen gets covered up by the taskbar,
There you go.
and then I have to find the share screen again. You okay?
Yep, we're good.
Okay, good. So don't fall. Keep your muscle strength up. Walk every day. Whatever you're able to tolerate. Do some resistance exercises. But most important of all, probably, is take some balance classes. And one of them is Tai Chi. If you get into a Tai Chi class or Qigong, I think Tai Chi has been demonstrated to reduce the number of falls. And you can go online and get some YouTubes. I ordered one from David Ross. He is a good instructor. That's actually my son's name, but he's not the one who did the video. It's another David Ross. The other thing is you want to make sure you have an adequate amount of vitamin D and try to get it from the sun if you can. And if you can't get enough from the sun, most of us in Oregon are covered up and don't get enough sun. So taking a supplement of about 2,000 international units a day seems like a reasonable thing. If you're not worried about not getting enough, then you may want to do a vitamin D level. If you have these diagnoses of osteoporosis, osteopenia, and some other diagnosis, potentially, you may get it covered under your insurance. If not, you have to pay for it. And I think you can do an online test to get it done for about, I don't know, it used to be $50 several years ago. It's probably up to $75 or $100 now. Don't worry too much about your calcium from your food, from supplements. I know in the United States, we recommend maybe 1,200 milligrams of calcium a day, but over in Europe and most of the countries worldwide, recommend about half that amount. You can get your calcium from the greens and beans in your life. And Christine was kind of curious about how much calcium we were getting in our food choices, and we eat quite a bit of greens and beans. And for just breakfast alone, she calculated we were getting about 950 milligrams of calcium from just our breakfast. So we'll go over as these classes continue on. You will go over how many, what that actually entails. But your body kind of regulates calcium pretty well, and it'll take what it needs. So You don't want to go under 400 or 500 milligrams of calcium. So if you're not eating any greens and beans, you're probably not getting enough calcium unless you supplement. But supplements put you at increased risk of heart attack and stroke, which we may be able to share with you in a video later. Stop eating animal products. You've heard this message before, I think, coming to these classes. I don't think it, I know it. There's a free app by Dr. Greger. It's called Daily Dozen, and I encourage people to use that because it's simple. You can keep track. It gives you a good proportion of the kind of food you eat. Do you have to follow it exactly? No. Do you have to follow it? No. You could go online to Physician Committee for Responsible Medicine, do their 21-day kickstart. You could do a program. I think John McDougall has a program that is a online program. I think it's continuing. There are so many things. You could come to our classes and learn how to, eat healthy. Scott has attached so many resources on the website to help you in your journey toward health. But this is how our classes got started, actually, is to help people transition their diet away from animal-based products, and processed foods, to whole plant foods. You want to be careful about eating too much sodium. So you want to kind of restrict the sodium in your diet, which means you're not eating a lot of processed foods and the canned foods with a lot of salt. You want to be doing weight-bearing exercises a few times weekly, 2 or 3 times, free weights or stretch bands. Sounds like a lot of things to do, but after you've been doing them, they don't take a lot of time, and you can kind of get into a habit, and when you're feeling good and you're not worried about breaking a bone, then it's well worth it. From my point of view, you get to decide, though, what's worth it to you. Get adequate sleep, reduce stress in your life, because stress can really, eat away at your bones. How do you do that? Meditation, fun activities. How does it do that? Eat away at your bones? You get an increased level of not only epinephrine, but cortisone. And that cortisone, like Scott was saying, if your patient has been receiving courses of steroid cortisone, it can thin your bones a bit. Restrict caffeine and alcohol in your life. And alcohol has recently been in the news about how any amount of alcohol is detrimental to health, not just for the liver, but for breast cancer, and I suspect other issues too. And if you plan to take a medicine, be sure to discuss the number needed to treat and the number needed to harm with your doctor so you have informed consent. So with that said, I'm going to close this down, and I want to play a first video for you. And then after we play the first video, we can come back and address each of those questions bit by bit throughout the night. But I just want to make sure those areas are, maybe you're thinking about it, and maybe you'll say, okay, I really want to know more about it. And we'll have a little discussion about it. So we're still in the sharing mode. So I'm going to go over here now to the video mode. Am I going to show all these videos tonight? No. It's videos we've accumulated over the years. Some of them are better than others. I'm going to start with milk. Is milk good for bones? So most of you who've been coming to these classes probably have an answer to that. But if you don't, let's hear what Gregor has to say.
Milk is touted to build strong bones, but a compilation of all the best studies found no association between milk consumption and hip fracture risk, so drinking milk as an adult may not help bones. But what about in adolescence? Harvard researchers decided to put it to the test. Studies have shown that greater milk consumption during childhood and adolescence contributes to peak bone mass and is therefore expected to help avoid osteoporosis and bone fractures in later life. But that's not what they found. Milk consumption during teenage years was not associated with a lower risk of hip fracture, and if anything, milk consumption was associated with a borderline increase in fracture risk in men. It appears that the extra boost in total body bone mineral density you get from getting extra calcium is lost within a few years, even if you keep the calcium supplementation up. This suggests a partial explanation for the long-standing enigma that hip fracture rates are highest in populations with the greatest milk consumption. Maybe an explanation why they're not lower, but why would they be higher? This enigma irked a Swedish research team, puzzled because studies, again and again, had shown a tendency of higher risk of fracture with a higher intake of milk. Well, there is a rare birth defect called galactosemia, where babies are born without the enzymes needed to detoxify the galactose found in milk, so they end up with elevated levels of galactose in their blood, which can cause bone loss even as kids. So maybe, the Swedish researchers figured, even in normal people that can detoxify the stuff, it might not be good for the bones to be drinking it every day. And galactose doesn't just hurt the bones. That's what scientists use to cause premature aging in lab animals. They slip them a little galactose, and you can shorten their lifespan, cause oxidative stress, inflammation, brain degeneration, just with like the equivalent of 1 to 2 glasses of milk worth of galactose a day. We're not rats, though, but given the high amount of galactose in milk, recommendations to increase milk intake for prevention of fractures could be a conceivable contradiction, so they decided to put it to the test, looking at milk intake and mortality, as well as fracture risk, to test their theory. 100,000 men and women followed for up to 20 years. What did they find? Milk-drinking women had higher rates of death, more heart disease, significantly more cancer for each glass of milk. 3 glasses a day was associated with nearly twice the risk of death, and they had significantly more bone and hip fractures too. Men in a separate study also had a higher rate of death with higher milk consumption, but at least they didn't have higher fracture rates. So a dose-dependent higher rate of both mortality and fracture in women, and a higher rate of mortality in men with milk intake. But the opposite for other dairy products like soured milk and yogurt, which would go along with the galactose theory, since bacteria can ferment away some of the lactose. To prove it, though, we need a randomized controlled trial to examine the effect of milk intake on mortality and fractures. As the accompanying editorial pointed out, we better figure this out soon, as milk consumption is on the rise around the world.
Okay, so we're going to reduce that. And before we get on to alkaline diets and how to check your pee, the color of it for alkalinity, we'll have fun with that one when we get to it. Before we get there, are there any questions from anybody from what you've seen so far? Anything burning on your mind?
There's a question in the chat about why does high sodium lead to osteoporosis, and I don't know if we have a video on that, but I don't think we know the exact cause, but inflammation, it does cause inflammation, and we know that chronic inflammation is a contributing factor to osteoporosis. And it's also a marker of a lot of processed food, and so if you're eating more processed food and less whole plant foods, then it's also going to potentially increase your risk for osteoporosis.
Okay. I don't have anything to add to that. Anybody else? All right. Well, let's get on to the next video, and then we're going to just keep going here with that share screen. And there we go. 2 more videos we're going to play before we open up for questions. Alkaline diets, animal protein, calcium loss, and then the second one will be testing your diet with pea and purple cabbage.
For most of the last century, a prevailing theory within the field of nutrition was that by eating acid-forming foods, such as meat, we were in essence at risk of peeing our bones down the toilet. And no wonder. Experiments dating back to 1920 showed over and over that if you add meat to the diet, you get a big spike in the amount of calcium being lost in the urine. And so this made total sense. I mean, we had known since 1912 that meat was acid-forming within the body, and how do you buffer acid? What are in antacid pills, anti-acid pills like Tums? Calcium. Meat and eggs have a lot of sulfur-containing amino acids, 2 to 5 times more than grains and beans, that are metabolized into sulfuric acid, which the body buffers with calcium. That's why the antacids like Tums are made out of calcium. Calcium can buffer acid. And where is calcium stored in the body? The skeleton. So the thinking was that every time we ate a steak, our body would pull calcium from our bones bit by bit, and over time this could lead to osteoporosis. Based on 26 such studies, every 40 grams of protein we add to our daily diet, we pee out an extra 50 milligrams of calcium. And look, we only have about 2 pounds of calcium in our skeleton, so the loss of 50 a day would mean losing close to 2% of our bone calcium every year. And so by the end of the 20th century, there was little doubt that acid-forming diets would dissolve our bones away. But if you actually look at all the studies done on protein intake and bone health, that's not what you find. So where's the flaw in our logic? Right? Meat leads to acid, which leads to calcium loss, which leads to bone loss, right? Well, it's uncontroversial that protein results in greater calcium excretion, but we've just been assuming it's coming from the bone. I mean, where else could the extra calcium dumped in our urine be coming from but from our bones? This is the study that appeared to solve the mystery. An intrepid group of researchers tried feeding a bunch of volunteers radioactive calcium, and then putting them on a high-protein diet. What happens when you put people on a high-protein diet? The amount of calcium in their urine shoots up. And indeed, that's just what happened. But here's the big question. Was that extra calcium in their urine radioactive or not? And to everyone's surprise, it was radioactive, meaning that the excess calcium in the urine was coming from their diet. Remember, they're feeding them radioactive calcium. So the excess calcium in their urine wasn't coming from their bones, but from what they were eating. What seemed to be happening is that the excess protein consumption boosted calcium absorption from down around 19% up to 26%. So all of a sudden there was all this extra calcium in the blood, so presumably the kidneys are like, whoa, what are we going to do with it all? So they dump it in the urine. 90% of the extra calcium in the urine after eating a steak doesn't appear to be coming from our bones, but from our diet. We're not sure why protein boosts calcium absorption. Maybe the protein increases the solubility of calcium by stimulating stomach acid production. Yes, more calcium lost, but more calcium gained, such that in the end, most of that extra calcium is accounted for. So in effect, more calcium is lost in the urine stream, but may be compensated by less loss of calcium through the fecal stream. This was repeated with even more extreme diets, an acid-forming 5 burgers a day worth of animal protein diet that limited fruit and vegetables, versus an alkaline diet emphasizing fruits and vegetables. More calcium in the urine on burgers, but significantly greater calcium absorption, such that at the end it was pretty much a wash. Other studies have also since supported this interpretation. Here's an ingenious one. Feed people a high animal protein diet, but with an alkali salt to neutralize the acid. Now, the old thinking would predict that there would be no calcium loss since there was no excess acid to buffer. But no. Even though the acid load was neutralized, there was still the excess urinary calcium, consistent with the radioactive isotope study, challenging this long-standing dogma that animal protein consumption results in an acidosis that promotes the excess excretion of calcium. So if our body isn't buffering the acid formed from our diet with our bones, how is it neutralizing the acid? Maybe with our muscles. Alkaline diets may protect our muscle mass, all covered in my next video, entitled Testing Your Diet with Pea and Purple Cabbage. Stay tuned.
Well, we don't have to stay tuned for long. We're going to just get right into it here.
If our body isn't buffering the acid formed from our diet with our bones, how is it neutralizing the acid? Maybe with our muscles. Our blood gets more acidic as we age, as our kidney function declines, and this may be a reason we lose muscle mass as we get older. The modern Western diet based on animal products generates an acid load that may cause a lifespan state of unnoticed and growing metabolic acidosis. And this chronic, low-level diet-dependent metabolic acidosis might contribute to the progressive shrinking of our muscle mass as we age. See, muscle wasting appears to be an adaptive response to acidosis. When our muscles break down, amino acids are released into the bloodstream. Our liver can then take these amino acids and make something called glutamine, which our kidneys can use to get rid of the excess acid. And indeed, in this 3-year study, those over age 65 eating alkaline diets were better able to preserve their muscle mass, which they think may be because the alkaline-producing fruits and vegetables helped relieve the mild acidosis that occurs with the ingestion of the standard American diet. But show me a study in which fruits and vegetables aren't associated with health benefits. So when the latest review asks, does an alkaline diet benefit health? If you're asking, does a diet low in meat, eggs, and dairy, all acid-producing, and high in fruits and vegetables with lots of dark green leafies, well then of course the answer is yes, an alkaline diet benefits health. But if you're asking, does it matter what the pH of your pee is, whether your urine is acid or alkaline, regardless of what actually goes into your mouth, then the answer is actually still yes, it does matter, but the accepted benefits of having alkaline urine appear limited to 2 areas: lower risk of kidney stones and better uric acid clearance. We knew about the kidney stones, but the uric acid data is new. Researchers found that alkalinization of the urine is effective for removing uric acid from the body. And if you remember, uric acid is bad stuff, potentially increasing one's risk of fatal stroke, heart disease, and death. So, those eating plant-based diets are at an advantage. The average vegetarian diet is alkaline-producing, and the average meat-eating diet is acid-producing. Even though there are some acid-forming meat substitutes, like some of the corn products, they're not as bad as something like tuna. And they're typically consumed in smaller quantities than meat consumers consume meat. As the protein in plants is usually accompanied by much more potassium, which is alkalizing, there is good reason to meet protein needs preferably from plant sources. And if you actually measure urine pH, those eating strictly plant-based diets have the greatest advantage, significantly more alkaline urine than omnivores. How can you tell what your urine pH is? Well, you can be all boring and order some pH paper strips to pee on, or you can use what you should have right now in your crisper, a purple cabbage. Everyone should have a red or purple cabbage in their fridge, since it's one of the best nutrition bangs for our buck. But you can also do science with it. You can either boil some until the water turns deep purple, or a quicker, safer way, since you're not dealing with hot liquids, is to just blend some raw in your blender with some water for that gorgeous purple, and then just strain out the solids. Then what you do with that royal purple liquid is you pour it in the toilet bowl after you pee. You can imagine how much fun kids have with this. If it stays purple, your urine is acidic, and you should eat more dark green leafy vegetables. If the toilet bowl turns pink, your urine is really acidic, and you should eat more dark green leafy vegetables. You're looking for blue. If it turns blue, that means your urine is neutral, or even alkaline if it's sky blue, and that means you should continue to eat more dark green leafy vegetables.
That's become one of my favorite videos. It's got a little humor connected with it, but it was watching this video that convinced me that I needed to buy a purple cabbage and put it in my refrigerator. I did test the urine with my grandchildren. It was a fun activity. I can't remember the results. This was a few years ago. But I have purple cabbage in my refrigerator every day. The crunch and the sweetness is a delight every single breakfast. I don't take a large amount, but it's a square of about maybe 3 inches by 3 inches. I don't know. You can do what you want, sometimes a little more, sometimes a less, whatever you're in the mood for. And it's a pretty magnificent snack to have around the house. And I learned that from Dr. Greger. Never had a purple cabbage in my house before I watched that video. So, anybody have purple cabbage in their refrigerators? A few of you do. Good. And for those of you I can't see, that's all right. Now, any thoughts from anybody else who is wanting to share?
Yes,
Or
I
have a
have.
question? Go ahead, Nancy.
I have purple kale. How does that compare to purple cabbage? In fact, excuse me, go show it to you. I'm growing in my garden right now, and I've been using some of that, and I was just wondering how it compares to the purple cabbage.
I guess that's a good question for Dr. Greger. I imagine the purple color is probably a similar compound, but I don't know for
I mean,
sure.
because they're both in the same botanical
Yeah,
family, and so
yeah. I would
I
say
guess
that
maybe grind it up and put it in the toilet.
yeah, and see what happens.
That's
I
what do you
think that
think?
would be, why don't you let us know how that experiment comes out? We'd be curious.
Oh, anyway, it's kind of fun. But
Um,
this stuff is still growing in my garden. I just picked some yesterday.
all right, does it have
Um,
a sweetness to it or just a crunch?
it's kind of tough at this time of year, I guess you might say.
Yeah,
I
we're
mean, just right,
purple cabbage, not it's sweet and it's crunchy and it's a delight.
I don't know that it's crunchy, but yeah, it's fun. It's fun. Excuse
Good.
me. I got some
Thanks for
stuff in my
sharing that.
throat.
It's a good question.
Yeah. So
Anybody else?
anyway,
I have a question.
Yeah, go ahead.
I've been taking, for a long time now, I've been taking 5,000 IUs of vitamin D. I had my levels checked recently and it was 64. Do you think 5,000 is dangerous?
Well, for a level of
Go ahead,
64 is
Scott.
okay. Yeah, level 64 is okay. As long as you want it to be above 30, but you don't really want it to be any higher than about 80. Getting up towards 80 to 100 can start to be toxic. It is a fat soluble vitamin. It's really not a vitamin, it's a hormone, but it's still considered a fat soluble, and so you want it just to be above 30. So whether that's with the standard 2,000 international units a day or if the 5,000, what's important is what your blood levels are and whatnot. And then it doesn't have to have vitamin K, K2 in it. So you're going to be getting plenty of vitamin K from the green leafy vegetables, and then the bacteria in your gut will actually convert the vitamin K to vitamin K2. So you don't really, that was a question that was in the chat. There's a couple other questions in the chat too you can look at, Charlie, address, but yeah, that answers that particular question.
Thank you.
Let's see. What about green cabbage? Green cabbage is probably fine. It's a healthy treat. I don't know that the green cabbage will actually churn your toilet bowl water based upon the pH like the purple cabbage. But green cabbage is healthy if you enjoy it. I actually like the purple cabbage. I like the color. It's fun. And I get a lot of other green in my life. So, but you get to decide what you feel best about. How much does sun help with vitamin D? Because I'm also reminded that us to use sunscreen to prevent cancer. Yeah. So, listening to Dr. John McDougall in the past, he seemed to feel that people could get enough sunlight. It can last for several months in your body. He was not a big proponent of supplementation. Gregor feels that supplementation is appropriate. So there is some, minor differences. I think what Scott mentioned, doing a blood level to see where you're at would be most helpful. But McDougall used to recommend, I believe it was about 10 minutes of sun exposure. And, you have to expose just more than your face. I think you would have to expose your arms and maybe your legs. And in winter, it's kind of uncomfortable being out there. And the angle of the sun when we're living in Oregon is different than when he was living in California. So I would say that 10 to 15 minutes of sun exposure, unless you're darker skinned, then you probably need twice that amount. So Alice, share what you'd like.
Thanks. So as we mature, which is code for age, we really don't absorb the vitamin D in our skin as well. And in the northern latitude, you guys are a little further south, but from October to May, you can't get enough sun. And you'd have to like lay out there in a bikini in the winter, but also with age, you don't absorb it as well through your skin. So I think the supplementation is if you're on the vitamin D train, which I still am, although I think you sent me the video from like Stanford where the guy was pretty compelling and he was kind of like, So, but I'm still, this is more of a faith thing on my part. I'm still on the vitamin D train.
Yeah. He was compelling for sure. And he said under 4,000 units seemed to be fine for most people. He was concerned about people taking over 4,000 units, that some of them may have had problems. But if you've actually had a level and it's in a reasonable level, it's probably okay.
The other thing is that if you use sunblock, you block 90% of the vitamin D that you could absorb. So you really don't get vitamin D if you're using sunblock.
So that brings us to, do you put yourself at risk of trying to get sun and sun exposure? You may, but if you don't have a family history and you haven't had squamous cell carcinoma on your skin before, you probably don't have to worry about it as much. But if you've had that, you probably really want to be careful and for sure get your vitamin D by supplement. Now, whenever we tell you to get a supplement, we always say that with a little trepidation because we're always telling you, be careful about supplements, right? That, it may not have what's in the bottle. There may be some toxins. So you have to find a company that you trust that has preparations that are actually health promoting for you. And I don't actually have an answer for that other than I've been using pretty much the same company for a long time and just, okay, take my chances. I hope it works. And so far, so good. But be mindful and be careful of buying off-brand. Scott, there is some label or something that goes along with USP, whatever. I don't know how helpful that is or not. You have any thoughts?
Yeah, just that, you just have to go with one that, like I've been using, like I'll sometimes use Nature Made, sometimes there's other brands, but I just look at, I took this medication, this vitamin D, and my level went up, or my vitamin B12 and my level went up, so it must have B12 and vitamin D in it. But other than other contaminants, there's no way to really know. I mean, just all the studies that Dr. Greger has shown on videos is like they'll go and just randomly to health food stores and pull off, dozens and dozens of different brands of different things. And then what they showed in those studies was about half the time, it's like a coin flip. Half the time wasn't even what was said on the label is in it, wasn't even in it. And then there were contaminants, like even like statins, like Lipitor was found in it, antidepressants were found in it. So it's just kind of, because it's not FDA regulated, so it's just kind of, yeah, buyer beware kind of a thing. So you just kind of, we don't endorse any particular brand or anything. It's just trial and error. It seems to work and doesn't seem to be causing me any side effects. Must be okay. But that's why we try to discourage supplements, except for some of these unique situations.
Okay.
So Yolanda has a question, which I'm going to answer with a video. But before I do that, Helena.
Yes, it is regarding the vitamins also. If we are looking the labels, then they are cheating. Some of these, they are not disclosing all the stuff that actually is inside, and you don't know that they hide some of the stuff, and sometimes you find later that they have all kind of stuff that you don't want actually to take, but it is very tricky with some of these vitamins to get the correct information what they have inside.
That's why we're telling people, we know that vitamin B12 needs to be supplemented in most everyone's diet. And we know that vitamin D3 probably needs to be supplemented in most people's diet. Yeah. And so the other supplements, be really careful about. Thanks for your input. And now I'm going to go on to, I'm going to share my screen. And we're going to answer the question, how does calcium supplements increase heart attack risk? And let's see, here's the share button. And let's see, I think it was the next video on the hit parade that we're doing. Are calcium supplements safe and are they effective? So let's see the safety of them.
In 12 short years, government panels have gone from suggesting widespread calcium supplementation may be necessary to protect our bones to do not supplement. What happened? It all started with a 2008 study in New Zealand. Short-term studies had shown that calcium supplementation may drop blood pressures by about a point, though the effect appears transient, disappearing after a few months, but better than nothing. And excess calcium in the gut can cause fat malabsorption by forming soap fat, reducing saturated fat absorption and increasing fecal saturated fat content. And indeed, if you take a couple Tums along with your half bucket of KFC, up to twice as much fat could end up in your stool. And with less saturated fat absorbed into your system, your cholesterol might drop. So the New Zealand researchers were expecting to lower heart attack rates by giving women calcium supplements. To their surprise, there appeared to be more heart attacks in the calcium supplement group. Was this just a fluke? All eyes turned to the Women's Health Initiative, the largest and longest randomized controlled trial of calcium supplementation. The name might sound familiar. That's the study that uncovered how dangerous hormone replacement therapy was. Would it do the same for calcium supplements? The Women's Health Initiative reported no adverse effects. However, the majority of participants were already taking calcium supplements before the study started. So effectively, the study was just comparing higher versus lower dose calcium supplementation, not calcium supplements versus no calcium supplements. But what if you go back and just see what happened to the women who started out not taking supplements and then were randomized to the supplement group? Those who started calcium supplements suffered significantly more heart attacks or strokes. Thus, high dose or low dose, any calcium supplementation seems to increase cardiovascular disease risk.
Sure.
So researchers went back digging through other trial data for heart attack and stroke rates in women randomized to calcium supplements with or without vitamin D added, and confirmed the danger. And most of the population studies agreed. Users of calcium supplements tended to have increased rates of heart disease, stroke, and death.
Yeah.
The supplement industry was not happy. accusing the researchers of relying in part on self-reported data, like they just asked people if they had a heart attack or not, rather than verifying it. And indeed, long-term calcium supplementation causes all sorts of gastrointestinal distress, including twice the risk of being hospitalized with acute symptoms that may have been confused with a heart attack. But no, the increased risk was seen consistently across the trials, whether the heart attacks were verified or not. Okay, but why do calcium supplements increase heart attack risk, but not calcium you get in your diet? Perhaps because when you take calcium pills, you get a spike of calcium in your bloodstream that you don't get just eating calcium-rich foods. Within hours of taking supplemental calcium, the calcium levels in the blood shoot up and can stay up as long as 8 hours. This evidently produces what's called a hypercoagulable state. Your blood clots more easily, which could increase the risk of clots in the heart and brain. And indeed, higher calcium blood levels are tied to higher heart attack and stroke rates, so the mechanism may be calcium supplements leading to unnaturally large, rapid, and sustained calcium levels in the blood, which can have a variety of potentially problematic effects. Calcium supplements have been widely embraced on the grounds that they are a natural and therefore safe way of preventing osteoporotic fractures. But it's now becoming clear that taking calcium in 1 or 2 daily doses is not natural, and that it does not reproduce the same metabolic effects as calcium in food, the way nature intended. And furthermore, the evidence is also becoming steadily stronger that calcium supplementation may not be safe. That's why most organizations providing advice regarding bone health now recommend that individuals should obtain their calcium requirement from diet in preference to supplements. But if we can't reach it through diet alone, would the benefits to the bones outweigh the risks to the heart? We'll find out next.
Yeah.
Okay, so I'm going to stop the share here right now. And I'm going to make sure that we have everybody muted because there is some background noise. So let's see if I can mute everybody. And then we are going to see if there's any questions from anybody now that you're all muted and the room is quiet again. So you can raise your hand and I can answer the question. And if you don't know how to raise your hand, you can unmute and speak up and we'll figure it out here.
Charlie,
I have a
a
speaker
question.
mode. Go ahead, Carol.
On my list of Daily Dozen from Greger, it told me that we should get 2 cups of leafy greens a day. And I noticed that the amount on that from the first video said 3 cups a day. And I couldn't see the recommended dosage that he gave for beans,
Okay,
which is
so
a cup and a half normally. Do we need to up that if we've got
no, a cup and a half of beans a day is an excellent amount. And the 3 cups, if you look closely, the cruciferous veggies are about a half a cup. And the greens, there's 2 more servings of greens that are a cup of piece. So on his daily dozen, he has 2.5 cups. If you are, if you're concerned about osteoporosis, osteopenia, get 3 cups. Just do the cruciferous greens, do a full cup of them.
Okay.
Now, Christine and I, to get 950 calories in for just breakfast alone, we do about 7 cups.
Milligrams of calcium. You said calories. You mean milligrams of calcium?
Yeah, milligrams of calcium. We do about 7 cups. Let's see, between us, we're doing almost 4 cups apiece of the greens, but we're doing the cup and about 3/4 of a cup of beans.
Okay. Well, they're two of my favorite foods, so it won't be.
So you're not going to have any problem getting enough calcium from your food.
Okay, that's good because I went from osteopenia to osteoporosis a couple of years ago, and so I'm trying to get those numbers down.
Okay, so in order to reverse that process as best you can, weight bearing, resistance exercises, sending messages back to your brain that my bones and muscles need to be stronger here. Can you add a little bit more structure to them? That is what is going to probably give us your biggest bang for your buck. Because you're going to be getting enough adequate calcium. And if you're taking a D supplement, you're going to get enough D. So in terms of the food issues, you're probably going to be fine if you're avoiding the animal products. But this is one area that gets left on the sideline so frequently. It's a habit of, it's not just walking exercise that you want to do. You want to incorporate 2 or 3 times a week some resistance training and weight bearing kind of activities.
Okay, so when you say weight bearing, we're not talking brisk walking there.
We are. If you're walking at a certain amount and you want to do it weight bearing, it's my take after years of debating about this topic. If you're going at a clip that is faster than you're used to, so in other words, you're really clipping along for you. You don't need to compare yourself with, the Olympic runner. You don't have to run, but you need to up your game when it comes to the pace at which you're walking.
I've definitely done that. And I've also upped my time to about an hour a day.
Perfect. That's good. And then either stretch bands or weights of some sort, a couple times a week, the
Okay.
large muscle groups.
Okay.
And it takes you 10 or 15 minutes to do that.
Okay.
All right, good.
Thank you, Jeff.
And then again, the most important thing for you, if you do have osteoporosis, is to not fall. So taking a Tai Chi class, doing balance exercises, maybe standing on one foot at a time for 30 seconds to a minute, and then increasing it up to 2 minutes over time. But make sure you have something you can hold on to keep yourself balanced if you need.
Okay, yeah, and I'm actually already enrolled in a Tai Chi and Qigong class, and
Perfect. You're doing great.
yeah, I have one other question, Charlie, if we have time.
Okay, and then Nancy.
Okay, I'm finding that my sense of where I am in space is not what it used to be. Proprioception, is that what that's called?
That's what that's called, yes.
Okay. Do we just naturally lose that as we age?
I don't think so. I think that, there may be moments when that happens. I'd say you need to keep yourself adequately hydrated. So most of us really don't get enough water. So an extra couple glasses of water a day, perhaps, or making sure your urine is light yellow to almost clear is an important thing to do. And then, of course, maximizing the oxygenation to your cells of your body. And you're doing that by doing, if you're maintaining a whole food, plant-based diet, avoiding the processed foods and the oils and that sort of stuff, hopefully things will improve.
Okay. Thank you, Charlie.
I think balance and proprioception is something we have to train. We kind of like with anything in the body, if we don't use it, we lose it. And so, continuing to work on balance and those things will help preserve it. But if you've had like a hip replacement or a knee replacement, there is documentation that you do lose some of that proprioception when you have artificial joints, because part of our balance and our proprioception is dependent on our joints being, as they're intended, not to be artificial. And so I know a lot of physical therapists that talk to their patients about, you've had a hip replacement, a knee replacement, your balance might not be what it was. Your proprioception actually starts to takes a hit basically. But so it just means you have to work that much harder to keep working on balance and flexibility and strength and all those things.
Okay, well, that's interesting because I did have a knee replacement about the time that I started really noticing this. It's funny because when I'm walking, if I turn my head to look at something, I mean, my body just starts going in that direction without any intent on my part. So, but I'll keep all those things in mind. Thanks, guys.
Yeah.
Okay, Nancy. Just
You're
unmute
muted.
yourself.
I was going to. So I went to when I went to the doctor for my last checkup. I mean, I'd already been diagnosed with osteopenia and osteoporosis and whatever. And so anyway, my doctor says, "Oh, well, you need to get 1,200 milligrams of calcium a day." And I said, "I think there's some new recommendations on that." And she goes, "Oh no, you need 1,200 milligrams of calcium a day." And so I was just wondering if there's some information or something I can send her that, I mean, because I
Yes,
know,
you just saw it on Gregor's site.
yeah,
You
right.
just
But
send the video on calcium. Is it safe? Is it effective?
okay, yeah, because I'm worried about all the other people she's giving this erroneous information to. You know what I'm saying? So
We do
anyway,
know
I'm
what
just
you're
like,
saying. We also have a
Yeah.
cardiologist who is telling people to do pretty much a paleo keto diet. And that's kind of aggravating. They come to us and say, our cardiologist is telling us to eat totally different from what you're recommending. And we don't have control over that, short of picketing outside the office. And I'm not ready to do that yet.
At least that person's
well,
an outlier. If you look at the recommendations from the American Heart Association, the American College of Cardiology, they don't recommend a keto diet. they recommend Mediterranean diet, which is like 90% whole food plant based. So that particular cardiologist is not following their own organization's guidelines.
So Nancy, I want to specifically address this issue with you. Again, where you're going to find it. Are calcium supplements safe? Are calcium supplements effective? You can find it on YouTube. Do that search with the name Gregor, or go to nutritionfacts.org, his site, and you can pull up the video from there and send a link
the
to,
link, okay.
okay?
Because yeah, like I say, well, I decided I wouldn't even get the bone scans anymore. Hey, I know I have osteoporosis and I'm not going to take the medication for it. So what's the point of getting a DEXA scan,
Well, you
that's what I
bring us to
decided.
the next video with that statement. But before we get to the
Okay.
next video, I want to see if there's one last question before we get on to the next video. Anybody else have any issues they want to talk about?
Well, I think a few meetings back, you talked about, or I think, or one showed a Gregor video that walking was not enough. And there's been a lot of little articles in the New York Times about walking versus running, or, like walking 3 minutes and then running a minute, and you really boost it up. And wondering if you had any thoughts on that.
Yeah, I saw the one where it was jumping up and down. They actually had people jumping up and down to give the higher impact, which was better than just walking. So just walking wasn't, like you said, wasn't really good enough. I mean, it's still considered weight bearing, but problem with doing things that are higher impact is then you have a higher risk of falling. And I think not falling is more important than doing the high impact. It's just if you can safely jump up and down in place, that would be helpful. But if that's going to cause you to get injured or fall down, then that's counterproductive.
Okay, let's carry on to the next share. And so there are like bone health and plant-based diets. I'm sure you know what that video is going to be about. There are some other videos that you could look up if you want to take a snap of this film, you can kind of look these up yourself because we can't get to them all. Almonds for osteoporosis, berries for inflammation and osteoarthritis, dairy and cancer. We're going to come back to DEXA scan. Someone has they're not muted. If you kind of look at your microphone and see if you can get an X on it, it'll save me from having to go to it. Whoever hasn't muted themselves. Let's see. And I think that's pretty, phytates to prevent cancer. If you're having trouble, there you go. Okay, everybody seems to be muted now. And I'm going to go back to, where was I? Share the screen. Let's go to the DEXA scan issue because it's an issue that we probably would like to discuss with you or get your thoughts. We had one opinion about not getting a DEXA scan because she's not going to do anything different. That you're going to hear in this video. And you may have a reason for doing a DEXA scan if it will motivate you to make some different choices. There was one last video, prunes for osteoporosis. So you could look at all those. They do, they are helpful and may surprise you. But let's look at the DEXA scan next.
Hello everybody. This particular video that I'm making right now is a remake of a video that I did about 3 weeks ago, and I had out of the whole video clip one erroneous line, but it was an important one, important enough that I thought it was good to retape the video. So here is the second review on DEXA scans, useless DEXA scans. Bone is living tissue and constantly remodels. Bone mineral density peaks during the reproductive years of women and then begins to decline during menopause. In other words, loss of bone mineral density is a natural result of aging. Osteoporosis is a condition in which bones become weaker and more brittle and therefore more subject to fracture. This is distinctly different from normal age-related loss of bone mineral density. Women in westernized countries are told that osteoporosis is an epidemic. We call everything an epidemic here in this country, and therefore a screening is necessary in order to catch the disease early. The screening tool is dual energy X-ray absorptiometry, or DEXA, but the problem is the test results from DEXA are based on a comparison of the individual's result to healthy young women, not necessarily compared to you when you were a younger woman. Most people think that the test is reliable and based on scientific evidence, but it's not true because, in fact, the main reason why DEXA scans even became widely used was not based on scientific evidence. It was based on the marketing efforts of Merck, one of the companies that makes drugs to treat osteoporosis. Every time I tell these stories, just you'd think that this stuff would not happen anymore, but it does. So here's the story of how DEXA became such a big deal. Fosamax, made by Merck, was the first drug in a category called bisphosphonate drugs, which were developed for the treatment of osteoporosis. The drug didn't sell well. And the reason was at the time that it was introduced, women were not diagnosed with osteoporosis until they experienced a fracture, which was not a common occurrence. In order to transform Fosamax into a blockbuster drug, Merck needed to change the way that osteoporosis was diagnosed. So the company, with the cooperation of a panel convened by the World Health Organization, invented the idea that loss of bone mineral density was a sign of disease, not aging. Change was significant because we're all getting older, so it meant that sooner or later we could all be diagnosed with it. At the meeting where this was decided, an arbitrary level of bone density loss was chosen to define the disease. The panel also had a discussion and determined that patients who were borderline would be labeled as having a newly made-up condition called osteopenia or pre-osteoporosis. We have pre-diseases for everything now. It's a way you can drug more people. The major problem with this is that bone mass does not produce the risk of fracture. For example, the incidence of fracture in Asian women is much lower than Caucasian women who have relatively higher bone mass. A study including 840 women aged 35 to 75 years of age from 5 rural counties in mainland China showed that almost all of them over the age of 50 had bone mass lower than the fracture threshold set for American Caucasian women, but almost none had signs of osteoporosis. Less than 4% of them had fractures during their lifetime. Researchers who looked at records for over 2,000 cases of fracture concluded, quote, "We do not recommend a program of screening menopausal women for osteoporosis by measuring bone density." Nonetheless, in the pursuit of profits, Merck set out to make testing bone density both easy and inexpensive. At the time, diagnostic equipment for osteoporosis was very expensive, and most doctors' offices did not have this type of equipment. So Merck purchased a medical device company, subsidized the manufacturing cost, and developed leasing programs so that every doctor's office and health facility could afford to have one machine. And so that's why you see DEXA scans free at health fairs and all that sort of thing. It made it really, really cheap. The company also mounted expensive advertising campaigns to warn women of their risk and also to convince doctors that women need to be screened with a baseline screening at the age of 50. Merck's lobbyists pressured Congress to mandate that Medicare reimburse for the scans, which paved the way for payment from all third-party payers. The diagnosis of both osteoporosis and osteopenia, of course, increased as a result. Fosamax became a blockbuster. Lots of other drugs were developed and released.
Benefit of watching Charlie.
Okay, I hear someone talking in the background, so if you could mute your computer, that would be helpful. Okay, thanks a bunch.
And approved by the FDA to treat pre-osteoporosis and osteoporosis. The fact remains, however, that DEXA scans are inaccurate. In addition to measuring a marker that has little to do with bone strength, several factors can influence test results, which include the particular manufacturer of the machine, the tech operating the machine, the clothes the patient's wearing, movement during the scan. The variability ranges 5 to 6%, even if you get everything right. Now, it's a variation that is much bigger than it seems on the surface because changes in bone growth and remodeling are measured down to hundredths or thousandths of a decimal point, so the margin of error can represent up to 10 years of aging and bone loss. In one study, bone specimens that had been immersed in hydrochloric acid solution specifically to degrade bone mineral density were then tested using DEXA. The researchers reported that the bone density of the specimens changed much more than reported by the scans. To illustrate the unreliability of DEXA, a New Zealand television show sent a 50-year-old woman to be scanned by 2 different brands of DEXA machines. She was slightly below normal when tested by one machine. When tested by the other, was told the results were so far below normal that she had osteoporosis and needed to begin taking medication immediately. The bottom line is that the scans are useless and most diagnoses are false. Since people have been trained to think that screening for all conditions is the best path for preventing disease or death, a lot of people ask me, well, if I'm not going to have a DEXA scan, what should I do? Well, there aren't any effective screening tools for osteoporosis and for most things at this time. Plus, the screening programs for almost everything except cervical cancer have been a dismal failure in terms of preventing bad things from happening. So there are ways to improve and maintain bone health, and that's what we should be teaching people to focus on. Instead of eat, drink, and be merry, have a DEXA scan and take Fosamax, how about you work on bones and preserving your skeleton, which was designed to last as long as you do, by the way, by doing the right things. So what are the right things? Well, first thing is diet. A low-fat, plant-based diet is better for preserving bone density, while a diet high in animal foods promotes loss of bone density. All right, so the right diet helps a lot. Exercise stimulates bone remodeling and leads to higher bone density. The more muscular you are, the less likely you are to develop osteoporosis or have broken bones. Body strength. A study published in the British Medical Journal showed that the risk of fractures could be predicted with an accuracy of 96% in men and 93% in women using factors such as body sway and muscle strength. Gastrointestinal health. A healthy gastrointestinal tract allows for the absorption of bone-building nutrients, including calcium from food. And then sunshine. Promotes the production of vitamin D, which is actually a hormone, not a vitamin. I have to throw that in every time the words come out of my mouth. But supplements are not a substitute and are useless for improving bone health. You actually have to go out in the sun. And then some pharmaceutical drugs like corticosteroids are thin out the bones, so be very careful about pharmaceutical drugs and discontinue those that you can. If you have already lost an abnormal amount of bone density due to any of the factors that I mentioned here, remember that bone is living tissue. I think there's a big misunderstanding that some people have that by the time you're 18 or 21, your skeleton is the same and it stays that way until you die, and that's not true. It remodels constantly. So you can build bone density by paying attention to the things that I just told you. The drugs typically used to treat it are useless. You can see articles on this in the Health Briefs Library. They're useless and harmful, and they actually cause some of the problems that they're supposed to prevent, like fractures. Nothing like taking a drug to prevent fractures that causes fractures. Good reasons to pay attention to the diet and lifestyle factors. Okay, hit the subscribe button if you're not a subscriber. Pass this on to anybody else who you think might.
So that should raise the hair on the back of your neck. I could see Alice saying, wait. We didn't take every word that this lady says as the gospel. She's definitely very opinionated. And when she says that a drug or a scan has absolutely no value, is totally worthless, there's a bit of relativity involved. In her mind, yeah, that's probably the case, but the bottom line is you have to kind of weigh the risk and the benefits. And she does present a number of points which cause us to expand our thinking and ask ourselves, why are we doing these tests? And when she mentioned that most of the screening tests, she says all the screening tests except cervical screening tests. Well, sigmoidoscopy has been shown to actually improve survival, but the GI specialists don't do sigmoidoscopy. They do colonoscopy. None that I have ever referred to are used to doing that. So in a sense, she's sort of right, but you kind of have to take some of what she says with a grain of salt, and you have to kind of think for yourself, why are you getting a DEXA scan? Is it going to help you to make some changes in your life that are beneficial, or is it just going to cause you stress in your life? Any thoughts?
And some of the, I was just going to mention some of the, that was a number of years ago. I don't know what year that she recorded that, but the even Dr. Greger has videos of the updated science on some of the drugs, the bisphosphonates, Prolia, Reclass, Fosamax, those. There's the overall, when he looks at it, I recall, is it's about a 30% risk reduction of a vertebral fracture if you fall down, and about a 10% reduction in a hip fracture if you fall down with these drugs. And so they do have some benefits, just not, but that's the whole thing, risk and benefit ratio. There's a lot of side effects and complications with them too. So, but there is, some benefits, just, not as much as you might think there is.
I
Go ahead.
wasn't totally in disagreement with her. She is right. I mean, the whole thing about Merck putting those machines in to create a market, she's absolutely right on that. I do find that if someone has a good result on a DEXA, it's reassuring to them. It's nice because they're like, oh, I'm so worried about osteoporosis. Oh, okay, I'm doing well. For the folks that are at higher risk, sometimes that is a motivator to get them to do some weight bearing exercise, some weight training. And then occasionally I'll have someone that's really high risk. And for those folks, now my reports will say their 10-year fracture risk, it will be like 48% or something. That scares me. I kind of, say, hey, maybe you want to take this medication. Like that's a pretty frightening number. So sometimes I get a really high number like that. That is worrisome to me. But no, I'm not in disagreement. It's just like for me, with a lot of the Medicare replacement plans, they pick some metrics that they want me to do, like monitor blood pressure, make sure your patient gets a mammogram. And DEXAs is one of the ones they pick. Like they really pressure me to encourage people to get the DEXA. I don't know why that's a popular one. They pick different things every couple of years, but that is one of the current ones.
So I just looked up the number needed to treat. That means how many patients do you have to treat over a 3-year period to prevent one hip fracture? If you had this information in front of you, would you choose to take the drug? And that's how I would address this for the bisphosphonates. You have to treat 167 people for 3 full years to prevent one hip fracture. To me, that seems like the 166 are then placed at risk, which means now we're looking at the number needed to harm. What are how many people are going to be harmed by this medicine? And the number needed to harm, I had it here somewhere, and then I lost it. Let's see. What is it? I don't know. Fosamax, number needed to harm. There it is, number needed to harm. So, it doesn't tell me what is the actual number. Fractures. I don't know. But osteonecrosis of the jaw is one of the things, bone and muscle pain, side effects. And so you have to decide whether it's worth the risk of those sorts of things. And how frequent they are, it doesn't really indicate on my quick search here. But I'll keep my eyes and ears open for the next session. Bottom line is, keep the discussion open. Don't be afraid to discuss with your doctor about, do I really want to take a medicine? What's the side effects? How many people are going to be helped by this? What do the studies show? And do you think I'm going to be one of those people? And you have to decide that are helped. And if you really think you are and you're afraid, then it might be worth getting the DEXA scan or, following up or even taking the medicine. But to me, the medications that we think are so beneficial may be more of a distraction from, the patient thinks, oh, okay, I'll take this Fosamax and it'll keep me from having the fracture. So, okay, I don't have to eat healthier. I don't really have to move more. The doctor's given me a pill. And I don't think most doctors actually couch their patient consent in a way that allows a patient to actually make an informed decision on it. A doctor's made up their mind usually that they either think the patient should have it or not, and they'll do what they can to get the patient to take that medicine because they think it really is going to help them. I don't know. What's your take on that?
I think we've been co-opted. So there was one, I don't know if it was a Gregor video or I don't know where I saw it. I thought it was here with you that the unpublished data that said on Fosamax that beyond 4 years there was actually an increased fracture risk. Was that
Yes.
that was and that was like
Yes.
and it is because they did have that recommendation to stop it after 5 years. And it was like, aha, so that's why. No, I don't think, I mean, when I get a patient who's super high fracture risk, that's worrisome to me. The other thing is a tall, skinny, white woman with long femurs and further to fall is to me is a higher risk than like a short little person that is closer to the ground that there and that's not just my opinion. There was a small study where they took x-rays from a radiology department and then they looked at these women, and the ones that had longer femurs had a higher risk of fracture. That this femur length correlated, because these tall, skinny, it's like a
Yeah,
straw that you could break. So, I think you have to look at the person. Did they have a smoking history? Were they, underweight for like their whole lives, never really built their bone kind of thing? But when I do get a high fracture risk, I do offer it and let people make yeah, and maybe encourage it a little bit, because that's a bad thing. Hip fracture is
yeah,
bad. I mean, spine fractures aren't great either, but they just make you all hunched over and they
yeah,
hurt. They're not going to kill you, but a hip fracture does increase, is associated with increased death rate. So,
absolutely. Okay, everybody. Anybody else have anything they want to contribute or share with the group? I see there is a note in the chat room here. And let's see. Okay, I'm going to go back to the share, and I'm going to pull up that original Office PowerPoint thing. Let's see. Did I share the screen? Not yet. Here's the share screen. And I'm going to pull this up right here. And we're going to open it up. Okay, so let's do a brief review. We did this at the beginning of class, and now we're going to kind of sum up here. Don't fall, do some balance. We've discussed vitamin D a bit. We talked about calcium. Get it from your whole foods, not from supplements, because the increased thickening of your blood can lead to increased heart attack and stroke. So hopefully you've learned something about that. Really transition best you can to eating more whole plant foods, as opposed and replacing those animal products as best as you can. Low sodium diet, you want to do. Not exactly sure why the low sodium causes bone loss. Have to do some more reading about that. Do the weight-bearing exercises, get adequate sleep, reduce stress in your life. This is a big one, which we don't probably spend enough time in helping patients learn meditation or yoga, but focus your attention on fun activities in your life. Restrict not too much caffeine, no alcohol in your life, likely. And, discuss the risks and benefits before you start taking a medicine, basically. All right. Any questions on any of these?
Charlie, can I follow up on the weight-bearing exercises? Somebody recommended jumping. Would that include like jumping on a trampoline?
I believe it would, but
Yeah.
again, you need to be super careful because to me, trampoline is easy to get off of balance. So if you had a trampoline that had some support that you were either holding on to and you could bounce up and down, holding on to something, that I guess would be valuable in my mind. Karen, you have some input on this?
Yes, I'm wondering about women who go through menopause early. Is there any data or anything? Do they have more risk of osteoporosis?
I believe they do, because when you lose your, estrogen kind of preserves bone. And so the earlier you go through menopause, then technically speaking, you'll have more bone loss. But is it something you have to worry about? Again, it depends on your body type, your genes, and you may not have to worry about it. When I first, 48 years ago, when I became a physician or started my first practice, I don't think I ever used the word osteopenia or osteoporosis. I didn't know that it really existed. And then I did run into a couple patients who had some vertebral fractures. We used to use myocalcin or something like that to cut down on the bone pain. We didn't have the bisphosphonates at the time. And people were not breaking bones right and left. You know, most people, like Pom Popper said, your bones are meant to last for a lifetime. And so it's our diet and lifestyle choices that have led to most of the problems that we focus attention on, but we never used to focus attention on that before. So
Yeah, I don't know. My mom only lived to age 60. I turn 65 next month and I will be able to have Medicare. So I'm considering having the DEXA scan because it's a free benefit. I've never had one before. But last summer in July, I had COVID and I was sitting in a chair. And when I was standing up, so I was halfway between sitting and standing, I had a very bad coughing spasm. And I still have a pain in my back from that episode. And I'm thinking maybe I should have my back x-rayed to see if I injured the bone or the disc.
you could do that. Would it change anything you do in your life?
Probably not.
So my advice is, if you don't think it's going to change anything you're going to do, you're not going to exercise more, you're not going to eat healthier, it's not going to motivate you to do anything different.
Actually, I find the walking and the exercise make my back feel better.
Well, there you go. Keep it up. Okay, Alice.
You know, soda consumption, which is incredibly high in phosphorus, and you know, teenagers drinking soda, and they're not laying down bone. Why are we seeing so much more soda consumption? I'm going to say it's the acidity of soda and the high phosphate load, which binds calcium in the gut.
I like that. You're
So
becoming a researcher.
I don't do it.
I like that explanation. I didn't put soda on the list. I should have. Anybody else have any thoughts, suggestions? We've got another minute or two.
your topic for next week.
Okay.
Okay, Helena first, and then we'll do the topic next week. Scott will. Wait, unmute yourself, Helena. First unmute. I'll tell you when it happens. You got a little red microphone. You got to click on it. There you go.
Okay. What I wanted to mention about the jumping, it just remind me that I'm actually doing yoga. That once a week in the yoga, there is a regimen that we are just doing the jumping or the marching for 5 minutes. Then I believe it is better than to go on the trampoline and to break your back.
I like that. Good suggestion. Running in place.
Or jumping.
Or jumping up and down yourself. But if you have something that you could grab onto in case you feel like you're falling, might be helpful.
Okay, you can even close your eyes. It is what we are doing. You are doing meditation and you have to focus inside and jumping. It is for more advanced people.
There you go. Okay. So that's a
and
great activity. Go ahead, Scott.
Next week is chronic kidney disease, kidney health. Kidneys, all about the kidneys.
What I need.
All right. This has been a fun session. We've enjoyed it thoroughly, and we look forward to meeting you all back here again. And we're glad to have the fitness trainer, Eric. Thanks for popping in. We try to talk about this intermittently as best as we can.
Thanks, Charlie. Thanks, Scott. Thanks, everyone.
Thanks
Very
for coming. See you
welcome.
next week.
Take care.
See you soon.